So why do we perform assessments post a screen? Okay, so the main reason that we're performing a joint assessment is because our client has failed a movement screen. And we just want to understand a little bit more about why that might be. To be clear, when we're doing the assessments and also the movement screens, we're not here to diagnose an injury. So we're not telling our clients that something's wrong. All we're doing is assessing available range of motion at a specific joint, and these joints will be the ones that are involved in the movement that we were screening for. So it's just a follow-on system to kind of narrow that field down, and from there we can get a much better understanding of what might be going on in our client's body.
Yeah, like we said in the module, exactly like Max has touched on, the screen is essentially just a filter. It tells us that something not quite right is happening, but it doesn't tell us who the culprit is or where that pain or dysfunctional movement pattern's coming from. So we'll have to dig a little bit deeper with these assessments. So like Max said, again, that active is going to be what their usable range of motion is, but let's see from a passive in terms of these assessments we'll do, what is their available range of motion, and let's see if we can bridge the gap between the two.
Absolutely, and that'll allow us to determine, is it a motor learning issue that your client possesses? If so, then that's just trainable, and that's going to get better through training. Or is there a actual restriction that we need to work around? Or is there something more that we need to then refer out for? So it'll just allow you to make the best possible decision going forward for your clients.